conflict between the Ethiopian army and rebels in the country's most populated region is having devastating consequences on civilians, and that's according to the International Committee of the Red Cross. Africa's second most populous country, home to some 130 million inhabitants, is being torn apart by several armed conflicts. While Ethiopia signed a peace deal to end a deadly war between federal and regional forces in northern Tigray in 2022, conflicts continue to roil the sprawling nation, especially in Oromia region. Here's a report.
In Ethiopia's conflict-affected Oromia region, residents of remote villages like Armagunfi are slowly regaining access to healthcare after nearly 2 years of disruption. But the scars of war remain. The Gunfi Primary Health Center, which serves communities in the West Welega zone, was closed for nearly 23 months due to insecurity. During that time, residents relied on makeshift solutions, including donkey carts, to transport pregnant women to the nearest functioning hospital.
The health center had been out of operation for a year and 11 months due to the conflict in the area, and as a result, local people have developed many health problems. We have been sending as many pregnant women to the Begi hospital as possible, using donkey carts to save their lives.
The conflict between federal forces and the Oromo Liberation Army has displaced hundreds of thousands and left many communities cut off from basic services. While the war in Tigray ended with a peace deal in 2022, violence in Oromia has persisted, drawing less international attention. At the reopened clinic, expectant mothers now wait for checkups, though medicine remains in short supply. Patients like Asiya Abdella say the return of services has already saved lives. Nearby, Begi Hospital, located less than 10 kilometers from Gunfi, is also recovering. Its director, Dr. Ephraim Tamiru, said much of the facility's equipment was destroyed during the conflict, and transporting medicine remains a challenge due to ongoing insecurity.
In the last 2 years, although our hospital staff were highly motivated, it was difficult to provide health services properly, as many of the medical equipment in the hospital was destroyed due to the conflict. Our district is located more than 700 kilometers away from the capital, so transporting medicine was very difficult due to security issues along the road.
The International Committee of the Red Cross has been supporting health facilities in the region, providing medical supplies, training, and logistical support. From January to June 2025, the ICRC says it supported 20 health facilities in Oromia, helping provide care to over 100,000 patients, including nearly 1,000 safe deliveries and treatment for hundreds of wounded civilians.
The conflict in Oromia has deeply affected people's daily lives in West Welega, a community which was known for their thriving markets and fertile farmlands. Today they are suffering in terms of their basic access to services, their own life and personal integrity. At the same time, the conflict has also ravaged existing infrastructure, be it schools, health facilities, water points, increasing the humanitarian consequences for communities that are stranded between both sides of the conflict.
Africa's second most populous country, home to some 130 million inhabitants, is being torn apart by several armed conflicts. Oromia, which surrounds the capital Addis Ababa, has seen clashes since 2018 between federal forces and the Oromo Liberation Army, with peace talks failing to yield progress. Authorities have classified the Oromo Liberation Army as a terrorist organization. but it claims to be fighting for the rights of the region's approximately 40 million inhabitants. Africa Bureau, WION World is One.